So where I first worked in medicine, where I worked as a scrub tech, it was where he had operated at LDS Hospital. He had operated there. And so I actually had the opportunity to work with people who had worked with him when he was still operating.
Okay.
And there was a really interesting story that I heard from this general surgeon who had worked with him. I think when this physician was like a resident, he was scrubbing a heart case with President Nelson, with Dr. Nelson at the time. And he's, so he said, they because he was this pioneer in cardiothoracic surgery. So they had done this big cardiothoracic surgery, and they were closing up, right? So they're sewing everything back together, and you go kind of layer by layer. And one of the things you do in the operating room is you keep track of things, you count things, and so you count sponges, and you count instruments, and you count sutures, you count all these things, so you make sure that nothing's left inside. And so they got up, and they wired the chest closed, and they were closing up the skin, and the nurse was like, "Hey, listen, Dr. Nelson, we're missing a sponge still." He said, "Well, keep counting." And they're still closing. They said, "We've counted like a couple of times. We're missing a sponge." And he said,
it's like a Grey's Anatomy episode.
And so he says, "Okay," and sponges in the OR have a little radio opaque tag on them. So you can take an X-ray. So they bring the X-ray machine in, they take an X-ray, and sure enough, it's still inside, right? So there's this sponge inside. And the standard answer for most surgeons is, one, to blame somebody else, right?
Yeah.
Right.
So this is somebody else's fault. And the other is to blame somebody else with lots of profanity and anger, right?
Two options.
Yeah.
Blame someone
or blame with anger. Yeah. And I remember very much this guy that I was working with said, so they get this X-ray, they see it back there, and President Nelson or Dr. Nelson at the time says, "Shoot, well, let's go get it." And it was just that simple. Like, just, clip the wires, open it up, and let's go. Like, why bring anger to the situation of something that just needs to happen anyway?
Yeah.
Like, it's not going to change anything for you. You're going to have to go do it. You can be angry about doing it, or you can just go do it.
Easier said than done,
Yeah.
but
Easier said than done.
But very valuable to practice.
Well, I love that. I mean, one of my favorite books of all time that changed my life was Jocko Willink wrote a book called Extreme Ownership.
Okay.
Have you never heard of it? But
Well, they changed your life. I should read this book.
Yeah.
it did. I won't go into that all the way, but it's pretty powerful. I mean, he was a Navy SEAL that like basically pioneered a lot of the warfare that and anyways. But that's what it reminds me of is the idea is to have extreme ownership over everything. And what that means is it all comes back to me. If I am if you're it all comes back to me. It just trying to get away from the victim mindset and being, okay, well, maybe I didn't train that person well enough, or maybe I should have said this at this time, or, you take that extreme ownership in life and it'll take you places. It's interesting. There's a lot more context to kind of get the actual point, but, since you've been talking, I've been thinking about just like, one thing I admire so much about physicians and doctors, and even just you getting to know you more and who you are, and just that ability to, you kind of just master yourself, more. And you see that a lot with doctors more than you do with other professions. And it comes back to what you were saying earlier of the delayed gratification, the hard work, and what was the third one?
A little bit of pain is okay.
And pain, a little bit of pain. Maybe it's like, what you do to get there and how it morphs you or how you change and become just, because I think back to his book, President Dr. Russell Nelson's book, it's just, a lot of the people that talked about him, they said like he was a master of his self. Mm-hmm. Like he had total control of his self. Like he was in charge. And where a lot of people, they can't say that. They can't say they're in charge of their emotions and, so anyways, pretty cool.
The sort of the interesting thing along that sort of two aspects of physicians kind of being that the process of becoming a physician. One, I think that this happens in many industries, but you can also be shaped by that process into sort of a negative way, right? So when I was working as a scrub tech, I worked with, 150 surgeons over the, during the course of my time and training and everything. And one of the things I remember thinking is, just because you go to medical school doesn't mean you have to be a certain thing, right? That process of becoming doesn't have to shape you. Because I knew really good surgeons who were really nice guys. I knew really good surgeons who were total jerks. I knew really bad surgeons who were nice guys. I knew really bad surgeons who were slow and mean. And you're like, well, gosh, you got a combination of three bad things. You're slow, bad, and mean, right?